Hello. So this week I had a patient who was a 66-year-old African American male. He came in with complaints of worsening fever, productive cough, shortness of breath, and a fever was up to about 101. First symptoms started about 8 days ago, and each day he's just felt a little bit worse. He reports that his cough is productive, a yellowish green sputum. He also reports that his appetite is decreased. He does have a little bit of chest discomfort with coughing and generalized body aches. His shortness of breath worsens with exertion and relieves with rest. His cough is worse at night. Sleeping in the recliner reduces nighttime cough. He has taken like a cough syrup, Mucinex, and Tylenol for his symptoms with mild relief. His past medical history includes diabetes type 2, hypertension, hyperlipidemia, multiple myeloma, and stage 3 kidney disease. He's currently on chemo for his multiple myeloma, and he is currently up to date on all his vaccines. As far as the assessment goes, this patient appears ill, but is not in distress. He looks well nourished. He's clean, has good hygiene. Vital signs were normal except for a temp of 100.2. His oxygen sats were 95% on room air. His last dose of Tylenol was 6 hours ago. His turbinates were a little bit swollen with clear drainage. He had rhonchi to his right upper and lower lobes with occasional wheezing. Otherwise, his physical exam was normal. The differentials for him were pneumonia, influenza, and COVID-19. We ordered a chest x-ray, a flu swab, and a COVID-19 PCR test. The flu was negative, and the chest x-ray ended up being positive for right lower lobe pneumonia. The treatment for him is Augmentin, 875 milligrams BID for 7 days in a Z-Pack. And this treatment regimen was chosen because of his immunocompromised state due to the cancer and chemo. He should follow up in about 10 days or before if symptoms have not improved. He was told to quarantine until we had the COVID results. Supportive treatment for him would still be like the Mucinex, Tylenol for the fever, and body aches. Avoiding cough syrup except at night as needed. He should be drinking a lot of fluids, at least 64 ounces a day, preferably more. Avoiding products that thicken mucus such as milk. He was educated on that and encouraged to do some deep breathing exercises every hour while awake. Flu, we threw that in there as a differential just because of the body aches, but his multiple myeloma also causes body aches, body pain, so could be a result of that. And then, of course, COVID, every symptom you have could be COVID, so we felt it was pertinent with his history to test for that as well. All right, that is what I have. Thank you.